Welcome to Smart News Station. This is your host, Sarah Montana, reporting live from Idaho. I'm here with today's top story about cancer. We're here with Idaho's first and second best cancer specialists, Dr. Flo, Missouri, and Dr. Joe, Mississippi.
Hello, Idaho.
How's my favorite potato state doing?
Now let's start off with what is cancer?
Cancer is a disease where abnormal cells divide without control and can invade nearby tissues. When cells are reproducing, usually the process is seamless and cells make an exact copy of themselves, but sometimes they get messed up.
These abnormal cells will reproduce and make it hard for that specific area of the body to function.
Oh no, is there anything we can do about this problem?
Well, cancer can be treated with open or minimally invasive surgery. There are even surgeries that don't involve a scalpel.
Whoa. What even is surgery?
Oh, I'm sorry. I forgot not everyone's a doctor like me. Surgery is a branch of medicine concerned with the diseases and conditions requiring operative or manual procedure. It is used to further explore the condition for different purposes. In this case, surgery would be used to remove things like groups of abnormal cells or tumors.
Oh, now I get it. How do patients know if this is the best option?
Surgery is the most recommended treatment for all cancer patients, in which it will be an effective treatment for their type of cancer. When the tumor is stationary, the surgeon is able to locate it through imaging machines before surgery and make the correct amount of incisions in order to remove it. Surgery requires the surgeon to locate the tumor, and if the cancer is moving, they would need to make many incisions of the cancer moves to find and remove it.
What if a patient has cancer that has already moved and spread, like blood cancer, and surgery wouldn't work for them?
Well, chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in the body. It is mainly used in cancer patients, but can also be used to cure bone marrow diseases and immune system disorders. There are plenty of different types, including chemotherapy infusions, pills, capsules, shots, creams, drugs, or chemo directly to the cancer.
Oh, okay, but how does chemotherapy actually work to treat cancer? Like, what are its side effects and how successful is this process? Like, if I had cancer, would chemotherapy be better for me versus other cancer treatment? Would I survive?
That's a good question, but it's not that simple. Chemotherapy kills cells that are in the process of splitting into two new cells, like cancer cells. It damages the genes inside the nucleus of the cell. So although you are killing the bad cells, you might also damage healthy cells during this process, which is why there are so many side effects.
Yeah, side effects include most obviously loss of hair and nausea and vomiting. More severe ones are damage to lung tissue, heart problems, infertility, kidney problems, nerve damage, and risk of second cancer. Sadly, chemotherapy will not work for all cancers.
Oh no. Survival rates range from 6 to 90% depending on the type of cancer you have and when it's diagnosed. When reaching certain stages, chemotherapy may need to be used in combination with other forms of treatment. Well, okay. I have another special guest joining us for this segment. With us today is cancer survivor Ken from Barbie, Life in the Dream House.
Yay! Woo! Welcome, Ken.
Hello, Idaho.
Ken is a cancer patient of mine who has agreed to tell us about his cancer story. So, no HIPAA violations here.
So Ken, I heard you lost your beautiful hair and were feeling very nauseous as a result of chemotherapy. Do you know why this happened?
Oh, Dr. Flo, let me tell you all about it. My hair is very important to me, so I had to do all my research. Apparently, cancer cells divide rapidly, and chemo drugs target cancer cells by destroying rapidly dividing cells, like the cells in our immune system, gut, and crucially, our hair follicles. They divide every 23 to 72 hours. Chemo can damage cells in the hair follicle, so growth slows and the hair falls out.
It was quite the tragedy. You were also constantly complaining to me about the nausea. I heard you did your research on that as well.
Right, it was not good, Dr. Joe. Apparently, nausea could be as a result of drugs breaking down cancer cells and other rapidly dividing cells in the body. As cells break down, they release byproduct chemicals that trigger the vomiting center. Another factor causing the feeling of nausea and vomiting is the disruption of cells which line the gut, because they are cells that divide rapidly.
Another patient of ours was Raquel. Her treatment plan included brachytherapy.
Actually, I think you mean internal radiation therapy.
Well, yes, they both actually mean the same thing.
Whatever. During this process, a radiation oncologist uses radioactive material which is sealed inside a seed, pellet, wire, or capsule and is implanted in the body using a catheter in the body directly into or near the tumor. Usually, implanting the device is a painless process and can be temporary or permanent. This process introduces a higher dose of radiation in a smaller area since the material is placed in the body in the area of the cancer. Brachytherapy is also helpful because since it is placed so close to the cancer, it harms less healthy cells, which is totes gorge.
What types of cancer is this usually prescribed for?
Well, brachytherapy is often used to treat cancers of the head and neck, breast, cervix, prostate, and eye. A common side effect includes tenderness near the place where it was implanted. While the catheter is in the body, the patient must be careful because their body will give off radiation. The overall survival rate is 90% for this type of treatment. It is best used in patients whose cancer has not spread or metastasized. In many cases, brachytherapy is combined with external radiation therapy to get the best results.
Wait, hold up. External radiation therapy? What's that?
Ah, yes, that's a good one. I'd like to introduce to you a patient of mine who is opening up about her experience with external radiation. Please welcome Barbara Millicent Roberts.
Hi, I'm Barbie. So external radiation treatment is actually the most common type of radiation therapy used for cancer treatment. It is a lot like getting a regular X-ray. The treatment itself is painless. A machine is used to aim high-energy rays or beams from outside the body into the tumor. It is very precise and normal tissues are affected as little as possible. It uses three-dimensional conformal radiation therapy, which is usually divided into smaller doses called fractions, usually given every Monday to Friday for 5 to 8 weeks. Weekend rest breaks allow time for normal cells to recover. The total dose of radiation and the number of treatments is based on the size and location of the cancer, the type of cancer, the reason for the treatment, one's general health, and any other treatments one might be getting.
Wow, that's a lot of treatment. How does it work and how bad are the side effects?
External radiation with a machine called a linear accelerator, which derives a beam of radiation out of a wide arm. The patient will never be touched by the machine, and the radiation beams are invisible, so you will not feel anything, but the machine will make a lot of noise. External radiation is usually prescribed for prostate cancer, lymphoma, and leukemia, and early side effects include nausea, diarrhea, erythema, bone marrow suppression. Late side effects like fibrosis and damage to nearby organs usually take place months after the external radiation treatment.
Is this successful treatment for everyone, or is there a more successful treatment plan for patients with certain cancers?
How successful external radiation therapy is depends on the type of cancer and the stage of cancer. Men with intermediate risk prostate cancer have a 95.5% cure rate, and men with a high risk of prostate cancer have a 91.3% cure rate using external radiation. The 5-year survival rate is 98.8%. When compared to brachytherapy, external radiation was as effective and in some cases more effective. My friend Professor Tom Shakespeare, who is a radiation oncologist at the North Coast Cancer Institute, led an 8-year study comparing the effectiveness of external beam radiation therapy with other common treatments such as brachytherapy. He said, when patients are treated with modern external beam radiation therapy, the overall cure rate was 93.3%, with a metastasis-free survival rate at 5 years of 96.9%.
Wow, you guys sure know a lot of stuff. How did you decide to become a cancer specialist?
It all started in grade school. In 4th grade, our school found out that the 5th grade teacher, Miss Moore, had cancer. She was diagnosed with colon cancer about halfway through the year. The parts of her treatment that were the most severe was when my class had her. She was still able to teach us, and she was an amazing teacher, but she had to go in once a week for chemo. I remember she showed up with a little pouch that she had to carry around with a tube going into her side, providing the medicine. In 2016 or 17, the cancer got really bad and she died. Our school dedicated the gym to her, and I remember there were so many people at the funeral because she touched so many people's lives. I was inspired to be a cancer specialist when that happened because I wanted to help people like her get better.